Thank you for the introduction, and I'd like to thank the committee for inviting me to give these lectures. This is the first of my 3 talks here on ultrasound of the endometrium. Now, when I told my trainee about this, that I'll be giving this lecture on ultrasound of the endometrium, there was a note of surprise. You mean you can talk on the endometrium for half an hour? Well, it's possible, and probably more. Anyway, ultrasound is very useful for assessment of not just the anatomical structure, but also as a way of evaluating the hormonal status of the woman. For the anatomical assessment, we can see we can evaluate the thickness of the endometrium as well as its appearance. It is also a biomarker for the estrogen status in the woman. Okay, and in fact, the more estrogen there is in the body of the woman, you get actually a change in the endometrial thickness. And this has been published in a number of papers. In fact, they have found that there's also correlation between the body mass index and endometrial thickness because of the estrogen production by the adipose tissues. It also can give you a sense of the histological status of the endometrium, and I will elaborate on that later. Okay. Sorry, I was just trying to make this slides the full screen, but apparently we can't. As you can see from this slide, the endometrium changes during the menstrual cycle of the woman who is premenopausal. She undergoes menstruation, the proliferative phase, as well as the ovulation and secretory phase of the cycles. And during each of these phases, the endometrium actually changes in thickness as well as in appearance. During the menstruation, we find that the endometrium is very thin, ranging between 1 to 4 millimeters. And the endometrium thickens to up to about 8 millimeters during the proliferative phase of the cycle. And at ovulation, you reach the maximum thickness of the endometrium of about 14 millimeters, and sometimes 15 millimeters also. During the secretory phase, there's a change in the appearance of the endometrium from a sort of hypoechoic, I'll show you the pictures, a trilaminar appearance to an homogeneously echogenic appearance. And in, as separate steps in the cycle, we should not actually tie ourselves down to numbers when we do ultrasound, but these are just guidelines as to what sort of thickness to expect. Okay, so if you get a endometrial thickness of about 5 millimeters at day 5, that's quite okay. And these figures should be seen as a continuum in the development of the endometrium during the menstrual cycle. So that you see from this that the endometrium actually undergoes a cyclical sort of change from cycle to cycle. And then in the post-menopausal woman, the endometrium actually becomes atrophic. And the maximum thickness that we would allow for a patient who is post-menopausal is around 4 to 5 millimeters. Oh, good. Thanks. Now we have the full screen. However, in women who undergo therapy, hormonal replacement therapy, or who are on tamoxifen for breast cancer, the maximum thickness allowed is up to 8 millimeters. Okay. And this applies actually to patients who are asymptomatic. If the patient is symptomatic, then actually the whole issue changes. You may have to intervene for these women symptomatic. And by symptomatic, I mean women with abnormal bleeding in the postmenopausal state. This is how the endometrium looks like during the menstrual phase of the cycle. You can see that the endometrium is very thin, almost confined to just a single white line in the central part of the uterus. During the proliferative phase, you get this trilaminar appearance, and you can see that actually the endometrium is the most interesting part of the cycle. You can see actually three white lines here. Okay, marker. Okay, you can see three white lines, the basal layer, and then the functional layer, which is a bit hypoechoic, and the central echogenic layer, which is the endometrial cavity itself. During the proliferative phase, the endometrium becomes echogenic, almost homogeneously echogenic. And it's also during this phase of the cycle when the endometrium becomes very transonic as well. And by transonic, actually, it enhances the sound very well.